Now we're going to look at two other ways we might reform the system going forward. Trying to bring excessively high prices in healthcare down through competitive bidding and the marketplace, and then transforming how we pay doctors and hospitals to care for patients so they focus on keeping people healthy rather than just treating the sick. Another major effort that needs to go forward is competitive bidding. As we saw, the Affordable Care Act actually has competitive bidding for things like oxygen equipment, wheelchairs, hospital beds, what are called durable medical equipment, or DME. The initial experiment under the Affordable Care Act was tried out in 91 locations, and it turned out that instead of having the government set the price, having private suppliers compete in a marketplace substantially dropped the payments. Prices for oxygen equipment dropped 41%. Prices for wheelchairs dropped 36%. Prices for hospital beds dropped 44%. Well, we should roll this program out to the whole country. We shouldn't wait to 2016 to do that. In addition, we should expand greatly what goods and services we actually competitively bid. Why are we limiting it to durable medical equipment and hospital beds? Why not add blood tests, x-rays, CT scans, maybe some of those devices like pacemakers or hips, and have suppliers competitively bid and drive the price down. Having the government set prices is not as good as a marketplace where different providers compete to provide high-quality, low-cost services. Probably the single most important reform going forward that we need is reform in how we pay doctors and hospitals. Now we largely pay on a fee-for-service basis. When a doctor performs a service, he gets paid. Similarly, when a patient gets into the hospital, they get paid. This incentivizes doing more, not doing high-quality medicine. We cannot change how we deliver care, keeping patients healthy and avoiding hospitalizations without changing how we pay hospitals and doctors. And that is the most important part. One experiment that Medicare engaged in was bundled payment. Remember, that is an experiment where instead of paying for the surgeon, the hospital operating room, the hospital recovery room, the anesthesiologist, any physical therapist, or other care that the patient might need, you put the whole thing together in one fixed payment and let them work together to improve the quality of care and reduce the cost. Medicare actually ran a bundled payment approach for heart procedures like bypass surgery, stents, pacemakers, as well as hip replacements and knee replacements. It's called the ACE demonstration project. It saved a lot of money and improved the quality of care. Medicare should expand those kind of bundled payments. Probably the most important thing Medicare can do is to give a timeline for shifting off fee-for-service slowly and deliberately. This gives reassurance to doctors and hospitals, removes the uncertainty, and allows them to transform how they deliver care. They should shift off either to bundled payments, to accountable care organizations, or to capitation, any other mechanism than fee-for-service, monitoring the quality and the cost savings over time. Giving the timeline allows the healthcare system to adapt. Finally, we need to recognize that Healthcare.gov needs to be run like an efficient e-commerce website, not like your typical government program. Well, the Department of Health and Human Services has taken an important step in that direction by saying that they're going to appoint an exchange CEO. But just appointing one person is not necessarily sufficient. It's important, but not sufficient in and of itself. The exchange needs to focus, like all e-commerce sites, on improving the customer experience, improving the products and offerings on the exchange, ensuring that they have the latest technology and it's working well, identifying where shoppers are being held up and trying to facilitate that effort. As I said, an exchange CEO is absolutely essential, but not all that has to be done. You need to develop new apps, for example, apps that allow shoppers to figure out what the total cost of the healthcare service is, not just the premium, but the premium with the deductible they're likely to pay, with the coinsurance, so that they can figure out what the cheapest plan is overall. We need apps also that help people identify what doctors are in the system and in the network they're going to select, what pharmaceuticals are available in that network. There's a lot of improvements that can be made and need to be made if this is going to be a really great shopping experience for millions and millions of Americans. It's the key cornerstone for facilitating improvement of the healthcare system. The Affordable Care Act was an important step forward in revising and reforming the American healthcare system. And we need to push forward. Healthcare Reform 2.0, these 6 different provisions, raising the cigarette tax, cracking down on fraud and abuse, streamlining the paperwork, expanding competitive bidding, shifting off fee-for-service to other payment mechanisms, and making Healthcare.gov a true 21st century e-commerce site are all important. How will the Affordable Care Act and all changes affect the healthcare system? We need to look over the time horizon to 2020 and beyond. What kind of healthcare system are we likely to have? What are the megatrends in healthcare for the future? That's where we go to next.